So we were so glad that we were able to Psyconnect with Dr. O'Brien, and we'll be learning from her today. So Ronnie, give us an introduction so we can start the conversation.
Sure. So I'm going to just read a brief bio from Dr. O'Brien, and then we'll get underway. Okay, so Dr. O'Brien is a clinical psychologist in New York. She has had the opportunity to provide care in a wide range of settings, including community mental health centers, a vocational school counseling center, college and university counseling centers, and a state psychiatric hospital for children and adolescents. Currently, Dr. O'Brien is a staff psychologist at a university counseling center, where she is also serves as the multicultural specialist and outreach coordinator and sees clients in private practice. Dr. O'Brien specializes in working with adult individuals and couples who are presenting with relationship distress, family of origin issues, life transitions, and exploration of identity. She is passionate about working with women of color, BIPOC, and transracial adoptees. She works primarily from relational and attachment-based frameworks to help deepen understanding and gaining insight and presenting concerns. With greater understanding and insight, Dr. O'Brien believes that opportunity arises to then integrate, reprogram, and make meaning of your experiences in more effective ways as you move toward living a more authentic, connected, and fulfilled life. And what a great introduction and a great way to bring in Dr. O'Brien. So thank you so much for being here today with us, Doctor.
Thank you so much for having me. I'm excited to be in conversation with you both and to connect further on this platform. So I really appreciate the time.
Thank you so much. Just, going through your bio, it says so much that you have done, and your idea of like what it is like to be a mental health professional, and special, as you work with emerging adults and college students. We talked about you have an interest in working with women of color and BIPOC, so there's so much there. But we do hope to learn today a little bit more about what it's like to work with emerging adults, college students, so that we can be more mindful when we were talking about it and also working with them as well.
Great. Yeah. I think that, when I was thinking about the reasons why I was particularly drawn to working with this population, or kind of thinking about my journey to where I am now, I think a lot of it was kind of kismet, in that when I first started my psychology journey, my first training opportunity was at a college counseling center. And it wasn't necessarily something that I knew much about, college mental health, working with college students. But that opportunity, my first training experience, really provided me the opportunity to work in that setting. And then over the next years, I just kept finding myself being drawn back to that population. And I've been reflecting a lot about how it kind of coincides with my own personal journey. And thinking about when I was in college, when I was an undergrad, how I was always thinking, it would be so nice to have these resources. It would be nice to have resources on campus that were more accessible or available to students. And while my undergraduate institute did have a counseling center, it wasn't a center that was very, very known at the time. You didn't hear it being talked about. You didn't really hear anyone going to the counseling center. I don't remember having any of the counseling center staff come and speak to our classes. So I really thought about, and some of the work that I do currently is thinking about the ways that we can make college counseling centers and those resources more available to students, but also more accessible. From even thinking about it from a social justice perspective. We have this notion that counseling or therapy is in the therapy room, right? And I think that is something that we need to kind of move away from, because as we're moving really rapidly and we're progressing really rapidly, we need to think about ways to outreach to the students and to meet them where they're at. So thinking about ways that we can be in their space How can we meet them in their space, talk to them about our services in their space, going into classrooms, going into even the residence halls and doing workshops, and getting away from the notion that therapy and the services that we provide have to look a very specific way in kind of the four walls of the therapy room.
Yeah.
So that's part of what drives me in helping the resources to be available, while also recognizing that mental health on college campuses is really complex. I think about even in the last few years where, I think that in the past, college counseling centers have functioned more, and when I say the past, many years ago, when they're functioning more as kind of career counseling.
Sure.
And helping students to develop some sense of identity around their career, their professional path. But now we're really functioning as mental health facilities. And in a lot of ways, the severity of the mental health concerns that college students are presenting with are increasingly severe in nature. And it's been really interesting to be kind of in that space as I'm seeing year after year the different concerns that are presenting and the severity of and the nature of the concerns that the students are presenting with.
I mean, you mentioned so many things here. One, we are to fight the stigma, right? Mental health symptoms, conditions, there's a lot of stigma. And then you live in your home, you don't have the social support, and now you are like in a new place, and who am I going to talk to? Can I trust this person? Can I trust anyone here to talk about my feelings, my deep thoughts? And so fighting the stigma, and so by raising awareness, I think that's a wonderful thing. And it reminded me of a couple of articles that Ronnie and I discussed in a different episode, where by doing workshops with the students, let it be in a high school level or college level, involving them in a conversation. More specifically, they were talking about suicide, so how to prevent suicide attempts and whatnot, so anything related to suicide. And so they put together these projects where the students would get very much involved, so very hands-on rather than just psychoeducation, and that connected with the students in a way that was different than just providing psychoeducation. So yeah, I mean, it's good, that I'm glad to hear, because we went to school, and I don't think I transitioned to so many colleges here because I moved around and coming from a different country when I was in college, so trying to navigate that system. But I know that a lot of people didn't know that there was a counseling center at the given schools that I went to, so a lot of people don't know that they're available, and how to actually reach out to help.
It's also interesting to think about on different campuses. So I've worked in a number of different counseling centers. Some are larger schools, some are larger campuses. Some have been smaller campuses, and it's always interesting to me to see exactly where the counseling center is located, because on some campuses, the counseling center is located kind of off campus. It's in its own building, it's in its own space. And then for some other counseling centers, it's in sort of the main hub of, around the student center. And I think about that a lot, because I think there's pros and cons to both of those things, in terms of making it accessible, fighting stigma. But it is, I do often wonder, what is the intention, and what was the thought process around going into where the counseling center is actually physically going to be located. And I also think that in terms of outreaching, there are so many different ways now, right? College students are great because they're so passionate in a lot of ways. So on my campus that I work, every year we do a lot of outreach programs and workshops around suicide awareness and suicide prevention. And like you were saying, Alfie, the students are more than happy to get involved. And it's a way that they're able to, you know, become more aware and to learn more. And then once they have participated in that way, the following years, I've seen that a lot of them come back wanting to be the trainers. So it's a peer education, peer training situation. And I think that's another great way to, you know, get the information out there. While also a way to have the students personally connected to the cause.
Definitely.
So I do want to touch on what you just mentioned with the outreach programs. I have a thought there, but I want to go back to something you said earlier about the location of the mental health centers. And speaking from my experience, my university center was like tucked away. It was like down a ramp, and it was hard to get to. And I don't know if they were trying to make it you know, more private, where it was an area that not many people knew, but because of doing that, not many people knew it was there, or a lot of people didn't want to walk behind there, and it was just. So I think the location and how it's branded and how it's presented can do a lot for the cause, right? And having individuals and college students feel welcome to the mental health center, right? And work on that stigma.
And I think about what also, you know, having centers that are kind of tucked away or not really visible, what message is that sending to the overall community? Is that giving the message that this is something that you kind of do in secret, or that, you know, you have to kind of creep away to be in counseling. And I think that there's something really nice when the centers are in the center of the community, because, you know, mental health is such a large part of students' life, all of our lives. So I think it's really helpful to have it also at the center of the hub of the community.
Exactly. It goes with normalizing the idea that it's okay to talk to somebody about their feelings, right? And it just because you go in a mental health counseling center, it doesn't mean that you are going to be diagnosed necessarily with something, you know, or it means that it can also be to work on your strengths, right?
Yeah. And that's where that outreach comes into play, right? And being able to provide that psychoeducation, because you know, I don't have a lot of training working with this population, but some of the things that I do know just from experience and just learning throughout the years is that, you know, awareness of mental health symptoms isn't extremely high with this population, right? Because you're transitioning into a new period of life, and you're on campus, and no, I'm sleeping more. I don't know what's going on. I'm like, I guess I'm just taking too many classes, right? And not being able to connect the dots, and just like LT and you, Dr. O'Brien, said, you know, having the ability to outreach and to provide education and provide awareness, and maybe give some information that may not otherwise be obtained, right? And could help a lot with coming forward and speaking about some of these symptoms that are problematic.
Yeah. I mean, I think that I often think about the reasons, the possible reasons for why we've seen such a shift in mental health on college campuses in terms of severity, and in terms of how many people are accessing resources on campus, both of which have steadily increased across the country, across campuses. And one of the reasons I believe is because a lot more people are going to college now. There's ways in which, you know, college is more accessible to folks, right. Both in this country and in international students as well. So that's one, you're kind of having more people coming onto campuses. And we've also seen that a large number of students are coming to campus with prior mental health histories. A lot of folks are coming to the center reporting that they've been in treatment before, and a lot have also received diagnoses previously. So that seems to be kind of on the newer end of what we're seeing. And I also think that there's just very particular demands of being a college student these days. There's very particular pressures, and that intersects with and interacts with your own individual identity. There might be, family pressures, individual pressures, but also there's this culture on college campuses that basically that you don't need to sleep, right? You're kind of, it's awarded, or it's really admired when you're kind of like going, taking full course loads and also working full time, and doing all these things. And that's sort of what is being normed on college campuses. So that's leading to a whole slew of mental health concerns, particularly having to do with depression, anxiety, huge sleep concerns. And I think that there's this also the inclusion now of social media and the impact that social media has on your identity and kind of just being at all steps of life. But when you're on college campuses, you're potentially more susceptible to social media, and there's no escape from it. Right? You're kind of just bombarded with it all the time. So there's a lot of factors that are going into play, but I imagine that the trends of college mental health are just going to continue in the way that they are. So my hope is working on these campuses, and I often speak with folks on who work in other colleges and different kinds of settings, different kinds of campuses, what we can do to continue to provide the most resources, while also recognizing that there's limitations. There's a lot of limitations actually in terms of what college counseling centers can provide. So kind of balancing it all out feels like a really delicate process.
You mentioned some of the struggles that college students face in college, and in my mind also a couple of things came to my mind. One was Adderall use, right? To most people, or to a lot of people, it starts even before college, but it gets more intense or more significant through college. And so that's one of the things too, that it's also associated with the lack of sleep. And then a lot of those people don't go and seek help, right? So that's a concern too. And other is the increase in substance use, that it's often unsupervised, right? And so those individuals, they become of legal age, they're doing it, so partying all the time and whatnot, which is affecting their sleep, which is affecting everything else in their body and their mind, and they're not necessarily seeking help either.
Absolutely.
Yeah, and I think why your work is so important, Dr. O'Brien, is because the coping skills, and you kind of alluded to it, LT, the coping skills, it really becomes I guess manifested in this area of life, right? And the things that we kind of use to get by a difficult week or difficult month is what we typically will go back to. So I think the importance of having healthy coping skills or developing, and if we don't have that, reaching out and finding help, so we can start to work on some of these more maladaptive coping skills, so these individuals don't have to turn to substance use, right? And don't have to turn to these other coping skills that just aren't going to be protective in the long run.
Exactly. Go ahead.
And I also think that it's, so the way that I think about my work is helping students, helping my clients to utilize the strengths that they already have, whether those be internal strengths, the external supports that they have, and being able to really identify those and utilize them in effective ways. I also think that what feels really kind of, and this is sort of working with all clients, but what feels really important to me is the connection, and being a support for my clients, of being functioning as a space where they know that, that they could come to the counseling center and be able to utilize the resources there, that they're not alone in the process. And that feels really important to me, along with the coping skills, along with kind of identifying and utilizing the internal strengths. Because I think that outside or on campuses, people are kind of competing in a way, right? Like, how much can you do? How many days can you go without sleeping? I've heard that before, where that's sort of something that people are talking about, and like the less sleep that you can function on, it's seen as better.
Right.
And I think that's a cultural notion, even outside of college campuses, that we really need to get away from. That our bodies, our minds, our whole beings, we need time to rest. And that's in fact a way that we're showing up for ourselves and taking care of ourselves. And as therapists and psychologists, I feel that it's part of the work to function as models for that, to really validate what they're experiencing, while also providing permission to take rest, to find time in your days to take care of yourself. And hopefully over time, as they're seeing that model to them validated, they'll be able to turn to that coping skill rather than some of these other coping skills, the substance abuse, other maladaptive coping skills.
One thing that comes to my mind is peer pressure, right? So you said that there's a challenge, let's not sleep for I don't know how many days and see how we function. So that's one way of doing it. And then so there's peer pressure when it comes to using substances and a lot of other things that they challenge each other. So it is a culture that it starts way before college too. But I think that you're in that adulthood again, like not being supervised by your adults, your parents or whoever caregivers, and so now there's this like, okay, now I really have to do what my friends are telling me, because otherwise I won't have any friends. So I think it's important for us to learn how to communicate, ways to help them set boundaries, and it's okay to set boundaries, and rethink of the idea of like who shouldn't or wouldn't be friends, and why should they be doing those things to us, right? So that we are okay and be acceptable by those people who are asking us to do things that are uncomfortable for us.
And I think something around setting boundaries in this context and kind of overall is anytime you're doing something different, or you're attempting to set different boundaries in your life, I always tell folks, it's going to lead to discomfort, whether that discomfort is with yourself or with the others around you, because you're doing something different, you're shaking up the system. And helping folks to, in those moments when they are setting those boundaries, to feel grounded, or to be able to ground themselves in those experiences in ways where they could be like, okay, I'm feeling uncomfortable. I'm noticing that other people are feeling uncomfortable, and it's okay. I can tolerate it, and I could kind of sit through it, or sit with that discomfort, and move forward. And it's in the outcome is that I'll ultimately be feeling better. And I'll ultimately be feeling more, balanced or aligned or whatever it might be for that particular person.
Sure.
There's a lot that is not, I think it's not talked about, which is like sitting with your feelings, right? It's something that when you were growing up, maybe our parents or society didn't say that it was okay to sit with those feelings, to sit with sadness. And it doesn't mean that you can't still be open and commit to doing something else, right? Just because you're feeling something, it doesn't negate that you have space to do other things. And I think it's a conversation now that it's changing the way we see things. And I think it's very apt. Yeah.
Better. So Doctor, I want to pivot just a little bit. So I think that we touched on a lot of great information and have a lot of background information and opened up the conversation about college students and their mental health. But I want to talk a little bit about your experience. So what are some of the more common either symptoms or presentations that you encounter on campus?
So I would say typically I see a lot of symptoms of depression, a lot of anxiety, a lot of sleep concerns, like I was speaking to previously. We also see a lot of trauma. So on my campus, there is one of my colleagues who runs our trauma track program, where we utilize kind of a version of TFCBT for those folks who have who are coming having identified that their presenting concern is sexual assault or sexual violence. Beyond the folks that are in that program, we often work with students who have trauma histories outside of those experiences. And I include that that a lot of folks are coming with racial trauma, different areas of exploration that they want to explore related to their identity, family concerns, family of origin concerns, or even just, academic concerns, relationship concerns, a lot of roommate issues, trying to navigate that space because, as you know, a lot of students are coming to campus where previously at home, they had their own room for a lot of them, or they shared a room with siblings or other family members. But now they're coming into this space where they have to negotiate it with 1, 2, or even 3 other people. So that's led to a lot of issues and concerns for the students. And I think about it also of of course, you're bringing these people who have very different experiences, worldviews, identities, and you're putting them all in a tiny room. So of course, there's going to be stress that comes out of that, or concerns that come out of that. But those are some of the more frequent concerns that I'm seeing currently on the college campuses.
Okay. Do you see any individuals, or have you, over your time working, have you seen an increase in eating disorders on campus related to, because of the social media use, or maybe just identity comparison issues? Have you seen any individuals in that realm?
So I don't know if I've seen an increase necessarily. I think that so on the campus that I'm at currently, for a lot of the folks who are coming, and it's during our intake process, we're seeing, this is someone who might have more of an active eating disorder that's more severe. So in those cases, we would be referring them out because we just we have limitations in that way. But in terms of kind of disordered eating and concerns related to that. I sort of just think that it is for a lot of students, or for a lot of young adults, it's just kind of there. I'm actually pretty surprised sometimes when students are coming to the center and we're asking about their relationship with their body, to their body, their relationship with food and eating, and they're like, I'm good, like I'm totally good, and I see that as I see that far less than folks that are at least coming and saying like they've had some concerns related to their relationship with their body, or relationship to food or eating. So I think that it's kind of just, it's, I wouldn't say it's increasing, but it's definitely just, it's there, and it's all over college campuses.
Okay.
So one thing that you mentioned, it was working with diversity, right? So tell us a little bit about work focusing on diversity and, when it comes to college students.
So I think that in terms of my role on campus, it's interesting, and I'm curious to hear the both of your thoughts on even kind of the terminology or the language around diversity, right? Because I sometimes wonder, and I imagine that in the future we'll sort of be moving away from using the terminology of diversity, because in some ways that can be perceived or heard as more divisive, because there's so many ways in which diversity shows up on campuses or just as humans in life. So that's one thing I was just curious, and I wanted to hear your thoughts about. But in terms of my role, it functions in different ways. So one of that is that I am out there connecting with different organizations on campus, outreaching particularly to different cultural groups and different organizations, different cultural organizations on campus, and I work specifically with them. And I think it also functions in that in the counseling center, I'm thinking of ways to expand our learning within the staff. In what ways can we continue our journeys toward cultural sensitivity, cultural competency? What ways are we doing, or what areas are we doing a good job with that? How can we do better? How are we functioning as an inclusive center? Are we affirming center? So it starts with the center and thinking of ways that we can move forward and better ourselves always, individually and as a team, and then thinking out to the larger community of how can we outreach, how can we provide resources, and thinking of ways to continue to expand our services in that way.
Because I know you have, I know you wanted, Ronnie, do you want to comment on what she was saying before? Because my brain was also thinking about other things that she was saying right now.
So you were posing the question to us about our kind of perception of diversity, and if we think where we should be moving in the direction of kind of negating that word, right? Is that kind of? Yeah.
I'm curious to, because I kind of sit with it, and I'm like, I have always used that language. I've always used the diversity, and more recently I'm just sort of like, well, how does it really sit with me? What does it feel like versus when I hear, inclusivity or inclusion. But I'm curious for others what their thoughts might be.
I Ronnie, if you want to go ahead first, because I already have my my thoughts running here.
Go ahead.
So, I mean, I think it's a great question. I don't think I've actually sat with it in a way to question the word per se. I think because of my journey in this country, I've sort of like embraced the word, and like, I'm diversity quota. I'm like going to be the person who is going to be maybe showing something different, or that will be bringing an accent, or like a different way of joking or speaking or behaving. So I think I have embraced that word and being like the diverse whatever I am, and so I don't think that it's going to be like that for every single person. And so I think that's what you're posing that, so I think there's going to be positive connotations and negative connotations. So I think it's something for me to start sitting through of it. And because I think it's similar, I think you can pose the same question for the word minority, because there can be something positive and there can be something negative associated with that word. And I tend to like fall more in the positive side of things. But it doesn't mean that everyone is falling that side as well. So of course, it's important to be mindful and sensitive to those who are experiencing the negative side of it. So I don't know, Ron, if you have something else different.
No, I'll just add to that. And for me, a lot of it comes from the intention behind the word. And I'll speak a little bit from personal experience in that, or the majority of my emergence into young adulthood and adulthood took place in a small town. So the word minority and the word diversity, it kind of took a different meaning, right? And it wasn't necessarily always positive. It was kind of like the role that you had to fill, right? You kind of it was kind of pushed onto you, and I think for me, going to South Florida, which is just a big cultural change, and that the word there, it took a different meaning. It was more of an acceptance, and I honestly didn't hear the word diversity much in South Florida, and for me, it was kind of a breath of fresh air. Like, I don't have to feel that I'm encompassing this role, and although that it was positive at times, I think, again, depending on the intention, it could be, there could be some negative connotation to it.
Yeah, I appreciate both of your perspectives. I think it's also a balance, and I love thinking about that. I'm always thinking about, what is the intention? And sometimes I wonder, while it could be really positive because there are aspects of people's identity that is unique, and can your particular worldview can bring so much to the table. And I think there's moments or spaces in which it can get into the territory of being sometimes being a diverse hire, in that your expectation is to kind of fill the role that you're going to be the expert for diversity across the board.
Sure.
Where it's sort of like, well, I only know my own experience. I've walked through the world just in my own experience. So I could speak to that as an expert. And I can teach and open up conversations around and related to diversity. And I think we need to move away from having this notion that folks that are in these positions or filling these roles are the speaker for diversity as a whole on college campuses.
Or want to be the speaker as a whole.
Yeah, because when I think of like I went to internship interviews or like my whole life, you know, I'm a little bit older than Ronnie and so I've done my share of job interviews and whatnot. So you could tell that I would be different than I guess most people over there. Right. And you know, I would be the one with an accent, depending on where I went to, you know. And so my experience, like growing up, and someone would tell me like, "Oh, you're too emotional. You have like too many emotions in your face," and I'm like, "Well, that's how I grew up. You know, people will talk with our faces. You know, I don't know what do you want me to do." And so I felt like that didn't stop me from trying to be me in my like own self, you know. So understanding that like I don't represent all women out there, I don't represent all Brazilians out there. I mean, there's disagreements within Brazil, you know, and there's cultural difference within Brazil, and so I think it's important to understand. But I'm like, I do embrace the word diversity when it comes to like my own self, and like I am not part of like most people here in this country. So
yeah, that makes a lot of sense. And I think about it, you know, as we're talking, I'm thinking about my role in that, you know, I'm very passionate about having resources and being able to be a center that really has values that are aligned with my own values in terms of being affirming and inclusive. And so a lot of my work, both with my individual clients, with my outreach work, with, you know, even when I'm in staff meetings, is very much connected to that. And you'll see kind of just the way that I think is coming from a multicultural perspective, and I'm always just thinking in that way. And at the same time, part of my intention is wanting to invite people in, to kind of call people in these conversations who may have different experiences that could speak to something that I can't speak to, or that could provide information that, you know, would be helpful for me. So I think it's both wanting to open up that space for people and like calling in different people on campus, different organizations, different you know, faculty members, staff members, and students, and really listening to their experiences, and then hearing that, and then, you know, how can we provide resources based on what's needed on the college campus that I'm at. And so I see that as a large part of my role, of being the one to go out into different spaces, and kind of collect the data in that way, or to really listen to people and be in conversation, and then bring it back and, you know, think about ways we can use that information.
I mean, that's beautiful. I mean, I don't know how many people attend that college over there, but I think you probably get some people like do a focus groups, you know, and try to learn so that you are more inclusive as inclusive as you can be, because again, it's really hard to like get to know 10,000 people within a year or one semester. As long as, you know, creating spaces to have people feel good about themselves, right? That they can be who they want to be, right? And not who they need to be in order to fill somebody else's shoes or images. Yeah, definitely. You know, it's like not every single Brazilian is going to behave the same way or think the same way, or every single woman will think the same way. So it's important to embrace the difference, the different thoughts, ideas, feelings.
Yeah, I think about that in terms of my clinical work as well. You know, each of my clients has identities. I have identities. Some are visible, some are non-visible, and in that space, you know, what assumptions might be made. You know, how might I be perceived in a room? How am I kind of perceiving my client based on certain identity factors, and being able to check in with myself around, you know, what biases might I be holding, what might be coming up for me, In what ways have I interacted with folks who have similar identities, different identities, and then being able to check in with myself around, there's room for me to learn more about particular cultures, particular identities, while also not making assumptions about this person's individual experience.
Exactly. And I think it's humble, and it's so important for us to ask, tell me more about this. I don't know, and say I really don't know where you come from, or I don't know anything about this type of job or this and that. Just tell me so that I can see you in a different way, the way that you want me to see you, right?
Right.
And I know it can be difficult. Go ahead, Ronnie.
Yeah, sorry. And just normalizing that conversation, right? I think a lot of times, especially on college campuses, you may not ask those questions and it just kind of gets swept under the rug, but starting to open up that conversation and either start it yourself as a minority or as a majority, and including other people and saying, okay, let's have a conversation. It's not something that we should stigmatize. It's not something that we should ignore, but we should adapt to it and speak about it and use it in a positive manner.
Mm-hmm. And with that, I think, we are in such a position of power and privilege in a room when we're seeing a client, and by using certain approaches, right, or utilizing some approaches, we can seek to reduce that distance with our clients and empower them, right? So when it comes to that, what are some approaches that you have utilized, in therapy?
Yeah, so I think first and foremost, when we're thinking about power and privilege in therapy, is don't exert power over your client. Taking a step away from the stance that you're the expert in the room, because while you are the professional in the room, you really want to take the stance of letting your client lead, and really taking a step back and being able to listen to their experience, and not being the one to kind of direct it, but really letting them lead the conversation. So I think that's a big part of negotiating the power in psychotherapy. I also think that just really knowing yourself, knowing your own identity, knowing the way that it might be perceived in the room, and also knowing your own history with power and with privilege. So in what areas of your life or what experiences have you experienced, or what parts of your identity do you hold a privilege there? Mm-hmm. Or what experiences have you felt that someone has been exerting power over you? And being able to really know that, when that's happening for you in the room, and having a plan, a strategy of okay, I'm noticing that I'm feeling the pull to kind of exert power over this client, because in the moment, in the interaction, you might be feeling disempowered for whatever reason. And being able to check yourself, take a step back, and give yourself the opportunity to choose to do something different in that space. But I think it takes a lot of really knowing yourself, really knowing the different identities that you hold and what that means for your interactions with your clients, being able to have approach yourself with humility and with grace, in that this is a process, right? So there's going to be moments when it's going to feel hard, or you're going to feel uncomfortable having to think about certain aspects of your identity and what that means for psychotherapy or your work with clients, and knowing that that's okay. And also having the supports in place. So seeking out consultation, seeking out supervision. And kind of going back to the beginning, I think a big part of it is also recognizing and naming the fact that as the therapist in the room or as the psychologist in the room, that just innately puts you in a privileged position. It puts you in a position of power. And knowing what that potentially might mean for the client. And noticing what the client, ways in which that might manifest. You know, sometimes I think that clients will, or one way I've seen this manifest is like clients will very much think that you are the expert in that they won't challenge what you're saying. Even if it's like, that totally doesn't resonate with me, they'll just like yes you to death.
Yeah.
And being able to recognize that might be out of their own experience with power, privilege, and authority, and being able to notice that with them, of getting curious of like, what's happening here? It seems like you're maybe saying yes, but it might be something that isn't resonating with you. Like what might be coming up for you? What might be happening here? So having explicit conversations around that and bringing it into the room, I think that's a really valuable way to, again, like model and norm that. Of this is a space where we could do that, where we can like grapple in it and be in this conversation, this uncomfortable conversation potentially together, and then we're going to come out of it, and it will not only will be okay, but a lot of times it will strengthen the relationship.
Yeah. I don't think I could have said it better.
Yeah, that was perfect. So many points there I think is necessary to hear for the general public and also for future clinicians. So just quickly, I want to go over, being able to be insightful, mindful, and self-aware of ourselves in the therapy room. I think, working through the schooling and everything, a lot of the focus is, of course, placed on treatments and the patients. But at the end of the day, to really provide and give positive treatment, or provide positive treatment, we have to be self-aware. We have to be insightful and understanding of what we're feeling in the moment. So yeah, that is such an important piece, and that's something that I am still working on and trying to improve each day.
And exactly what you just said, right? You're working on it. So for those of you listening or watching this, and you're not in touch with your feelings right away, right, as you're talking to your clients, because you're trying to be so present and listen and absorb everything that they're saying, that there's a little bit of a distance, from what's happening within your body. That's okay. As Ronnie said, it's something that he's working on, so you can still work on, it's something that we can evolve. And
I think that it's, in my work, I'm kind of just, and I've heard a lot from folks at different stages and in training and things like that, of like being so focused on like, what am I doing? Like, what is the next thing that I'm going to, what's the next intervention, that you could really get away from the way that you're feeling in the room, like what's coming up for you, because you're also a human being. So being able to recognize that your own feelings, your own being, and your own identity in the room is such a powerful tool. Along with everything else that we're taught in school, but your own self-awareness and your own insight is in my opinion, is just one of the most powerful tools in therapy.
And you mentioned something earlier about tolerating and sitting with the feelings too. And sometimes it, like the client is saying something that will activate, will trigger something inside of us, but it's not about us necessarily. I mean, it's not about us at all. It's still, so it's learning how to sit with that feeling, but at the same time, that feeling can still be used in a powerful way to promote something meaningful in therapy too. So
yeah. And I think that, anytime that something is kind of triggered for me or something comes up for me in sessions, I do this quick check-in with myself of, I wonder if this is something that has come up before with this client. Is there something that might be happening in my own kind of personal life that might be making me feel more triggered by this, or something that's happening in the space that we co-created with our clients? And just being able to kind of like filter through that is something that's really helpful, but it's a process, right? Because there's so much going on, even though from the looks of it, it's just, you see two people in session kind of sitting together, but there's just so much going on in that space. But really being able to give yourself permission to kind of slow it down, to consider what might be happening for you, and how might you potentially be able to use that for the benefit of your client.
Yeah, and use that, as you said, to the benefit of the client, and finding ways to empower the client who, again, in this situation might see themselves disempowered, right? Because we hold the power as the therapist in their mind. And so finding a way to, one, give permission. So yes, that in one way we are using some level of power here by giving somebody permission to do something. At the same time, it's in a way that it's humble, and then it's empowering them and giving them like, okay, it's all on you now. Like, I mean, not like that, of course, but it's, finding a ways to empower them so that they see themselves through different lenses.
Yeah. And I think it's also really helpful for, clients to have an understanding to help them have an understanding of their own histories of, power and privilege, and being able to notice for them outside of the therapy space of, like how can I notice when I'm feeling disempowered or moving away from that space? And depending on the situation, you have to gauge, what's the kind of safety around that situation, and whatnot. But then helping them to have the tools to move into a space where they are feeling more empowered in a way that feels good for them and that feels safe for them. And that could look really, really different depending on the situation and kind of interaction. But even opening up the conversation, a lot of clients are like, oh, I've just never thought about it. It's just, I just walk through life and I notice that things feel like happening and it doesn't feel good. Or, I feel like dismissed or invalidated, but I'm not really sure why. But being able to get clear on like when that's happening, in what ways is it happening, how are you experiencing it, and how can you move into a space of empowerment.
And then, like, I think in school, I mean, I can't speak for every single school, okay, but I think based on what I've heard in our experience here, me and Ronnie, I think we're taught like about psychodynamics, a couple of things in there, and then we're taught about CBT, and so some of approaches there were all talked about outside of school as well, but I don't think we learn enough about power and privilege and how like some of the approaches address them, like relational culture, feminist approaches, and the narrative, and so I think it's sad that we don't get those opportunities at school, but I think it's important to know and to raise awareness that those approaches are out there, and there's benefits to learn from them so that we can find new ways to use those tools in therapy.
Yeah, I think it's so interesting, right? Like how you look at a lot of programs, a lot of psychology programs, and you'll take classes typically on CBT or maybe like one dynamic class. But there are all these other orientations that are so useful. I also think you just triggered something about like the diversity in graduate programs of a lot of times you'll take the like one class on multiculturalism and diversity.
Right.
And then it's kind of sprinkled in on the different syllabi, but never really the focus. And I'm just like, that's so interesting, because it should be, in my opinion, the kind of overarching theme around everything that we're doing. Because it speaks to us just being human beings in the world. Yeah.
Right.